Hello, I'm Michael Dube, orthopedic surgeon at Benefis Orthopedics. If the pain is that severe and it's been going on long enough and it's limiting your ability to do the things that you would like to do, you should come in and have your hips x-rayed to see how significant the arthritis could be. It is something that you shouldn't have to live with. If it's something that is interfering with things you like to do, it may be something that could be easily remedied. Allergies to the metals used in hip replacements are quite rare. The metals used are titanium and cobalt chrome, which have very low incidence of allergy. However, if it is a concern, you could be tested prior to surgery with doing allergen testing to the same metals that we would use in a hip replacement. If that turned out to be normal, then there wouldn't be any concern about rejecting the metals used in your hip. Patients who have femoral acetabular impingement, who have had bony procedures done to correct bony deformity, are at risk to go on to require total hip replacement in the future. I think that it is probably more likely than not that you would need hip replacements in the future. The way to tell whether or not this is impending in the near future is by performing x-rays and seeing your orthopedic surgeon for examination to see how your hips are functioning. If your hip pain returned and was quite severe and your x-rays showed that you were going on to degenerative arthritis, then you would be progressing toward hip replacement.
Hi, my name is Dr. Alexander Chung. I'm an orthopedic surgeon here at Benefis Orthopedics. My general rule for bone and joint pain is that in the absence of any trauma or injury that happens acutely, when you develop bone and joint pain, you should probably seek help after you've tried to treat it conservatively for about 2 weeks. And things that you can try before seeking help is, over-the-counter anti-inflammatories like Aleve or ibuprofen, ice, elevation, rest. These are the common things that people can do, and I usually give it about 2 weeks, and if it's still bothering you after 2 weeks, then you should probably think about coming in to see somebody about that pain. There are braces that can help unload an arthritic knee, and those unloaded braces usually work best for knees that are in varus angulation or in patients who are bow-legged. There's a specific type of unloaded brace where a patient can wear it and it unloads the inside of the joint or the medial side of the joint. And that can help alleviate some pain, but it is not curative. But it can help patients decrease some of their pain. Generally speaking, they last about 20 years. After about 20 years, there was one series of studies that suggested that the total knees survive. 95% of the total knees can survive for that long. And so, generally speaking, I think the teaching now is about 20 years if you treat the joint well, meaning you don't abuse it, you don't overexert, you don't subject the total joint replacement to a lot of trauma. That was prior to some new plastics that have come out. And with the advent of the newer plastics, we suspect that it'll probably extend the life past 20 years. We try and encourage patients to keep a BMI or body mass index below 40 prior to undergoing a total knee replacement. So it's a ratio of your weight to your height, and it's called the body mass index. Why do we choose a body mass index of 40? We choose that number because there have been studies that suggest that patients who undergo total joint replacements who have a BMI higher than 40 have a 13-fold increase in complication rates. And so in my particular practice, I see patients of all weights, but in the patients who are contemplating a total joint replacement, I strongly urge them to get below a body mass index of 40, and we will not proceed with a total joint replacement until the patient's body mass index is at or below 40. I think one of the best things that patients can do to protect their joints is, number one, to keep their weight down. Um, the lighter a patient is, the longer their natural joints will last. The other thing that you can do is to avoid traumatic, heavy, repetitive, jarring activities. So activities like walking, swimming, cycling are all better for your joints than running a marathon, jogging on hard surfaces, things of that nature. Um, Keeping active is also very, very good for your joints. So walking is one of the best exercises to try and get your joints to last as long as possible because it is low impact. It also is a good way of making sure that the joint stays supple. The chondrocytes, or the cells in the joint themselves, are nourished by movement of the synovial fluid. And so activities that are low impact and fairly smooth, like walking, cycling, or swimming, will be more beneficial for your joints than heavy impact activities. That really depends on what your insurance is. Different insurances will require different referral patterns. So if you have a question like that, please feel free to call Benefis Orthopedics and talk to one of the service representatives, and they can direct you to the appropriate experts who will probably ask you questions about what your insurance company is, and get a better idea for you about whether or not you can just make a direct appointment or if you need a referral.